Dr. TJ Tsay. Now we're going to go to your patient here.
So this lady, probably late 30s, looking for a new boyfriend and feeling really kind of tired.
Did she find one?
She did. A much younger guy. So she felt like she really needed to keep up and look refreshed for him. So the before was before any type of treatment whatsoever, and then you can comment on the afterwards. We can start with you.
So in her before picture, she looks very tired. As you can see, the under eyes do look tired. She does have the tear trough depression there. She does also have the oral commissures. She has a deficiency in that area as far as the oral commissure. Her chin in the before picture is interesting because it looks fuller than in the after picture. So I'm not sure if there was any weight loss or if there was any kind of manipulation on your part as far as non-surgical. As far as the skin and quality, you could see her pore size has diminished. Her eyebrows as well have changed a little bit, but also the lighting is a little different as far as the shading and as far as the forehead. In this patient here, I would give her some facial definition and contouring because her cheeks are pretty flat. I would go ahead and give her some contouring in the cheek area. I would also give her some tear trough fillers. I would combine the neuromodulators. And it seems like you did some neck tightening underneath there because her before picture, her neck is also fuller, and underneath it looks at the after much better, much more improved. So mesotherapy, and when I say mesotherapy, and that's something that I try to clarify to people, meso is an actual technique. It's not about just Kybella. You can use meso, and it's something that started in Europe for 25 years, even way before it hit the United States. So meso is a matter of your technique, approach, and process and what you're putting into the product. It does not necessarily have to be Kybella. It could be actually hyaluronics, it could be serums, it could be a combination of anything. When I say mesotherapy for the skin, that's what I'm referring to. I prefer to say as far as submental fat dissolution, then you're looking at Kybella or PCDC as far as shrinking the fat. And light-based energies, I think, are very important for anyone. And I always tell patients that they're never too young to start with light-based therapies. They're never too young to start with Botox as prevention for neuromodulation and lines and wrinkles, and skincare.
And Dr. Kassir, feel free next to comment on how you would approach this.
Yeah, I mean, I'd agree with what we just said. So absolutely treat her skin with skincare and perhaps even a laser. Fill what I call the shadows on the face, and it looks like some sort of energy or laser or maybe even a lift has been done on her with threads.
So this is an Asian patient, and I know that Asian, they have great cheekbones, right? So the techniques with Asian have to be very delicate because the way you inject a zygoma on an Asian, the angle changes. It has to be completely different the way you inject a Caucasian or Latinos or European patient. Asian is known that they have very flat forehead, flat nasal root, the maxilla is flat, and the chin tends to be retruded. So to me, you did a nice job achieving that oval shape, which is very desired in the Asian community. I think it is obvious that fillers used to give some of that volume in the mid-face, which most Asians lack. By doing that, you will improve the tear trough. I don't know if you injected the tear trough because sometimes just by improving the mid-face, the tear trough, somebody of Asian descent will get improved without going there. And I can see the elongation of the chin. It looks more feminine, more pointy. And the lower lip looks enhanced, which adds to this more alluring, beautiful, more attractive version of herself without changing who she is or westernizing her features.
That's actually a really good point. And in fact, more than 50% of my practice is Asian. And they absolutely, if you treat Asian patients, please don't widen their zygoma. They already have wide zygomas and they absolutely hate it. What's really lacking in a lot of Asians is actually the medial cheek area. That's particularly a big problem with Asian population. So yeah, I did use more fillers. In fact, what I did with her is this is the after pictures after 2 rounds of, the first round was 5 syringes of Bellafill, and then the second round was another 5 syringes of Bellafill. So a total of 10 syringes of Bellafill. Keep in mind each syringe of Bellafill is only 0.8, so it's not radius is 1.5 or the volume was 1, it's 0.8, so it's actually less than a cc. And so it's starting top and bottom. Yeah, her forehead was very concave, and this is a big thing with Asian culture too, is they have to have a good forehead. They're so obsessed with their foreheads. If you go to Korea, as often as women get their lips done here, they get their forehead, fat transfer to the forehead, fillers to the forehead. It's a sign of good fortune, good health, and good luck to have a nice, prosperous forehead, which reflects on a prosperous lifestyle. So I did fill in the forehead, the medial cheek, a little bit in the tear trough. I'm a little bit careful about PMMA in the tear trough, and I go submuscular, 0.2 at a time, so not a whole lot of volume, just to be on the safe side. I did do some hyaluronic acid HAs in her lips, and she's coming back more for more bellofill, and the next will be some threads.
Great results.